Hi, and welcome to Group 2's presentation of regulatory bodies, presented by Hannah Hunt, Neal Ziedan, Sumita Thapa, Sowande Coker, and Gaelle Bieleu. In this presentation, we will present an overview of the U.S. nursing regulatory bodies, the role of the NCSBN, the guiding principles of nursing regulation, the role of the Global Regulatory Atlas, discuss the governance powers of the nursing regulatory body, and as well discuss the Nurse Compact Licensure Agreement. We will present two different viewpoints for nursing regulatory bodies, discuss the legal, ethical, and practice implications, elaborate on the roles of regulatory bodies in regarding the positions of professional organizations, as well as present a summary, solution, and conclusion to our presentation. So what are the U.S. nursing regulatory bodies? Well, more than 100 years ago, state and territorial governments established NRBs, nursing regulatory bodies, to protect the public's health and welfare by overseeing and ensuring the safe practice of nursing. NRBs achieved this mission by outlining the standards for safe nursing care and issuing licenses to practice nursing. Now, to reiterate, the nursing regulatory bodies, NRBs, that comprise the NCSBN, protect the public's health and welfare by assuring that safe and competent nursing care is provided by licensed nurses. Nursing regulatory bodies, through boards of nursing established under the Nurse Practice Acts, are jurisdictional governmental agencies in the 50 states, the District of Columbia, and 4 U.S. territories that are responsible for the regulation of nursing practice. Each state and U.S. territory is assigned a board of nursing, and all 59 NRBs in the U.S. are members of the NCSBN. Now, there are 4 main focus areas for the boards of nursing, and those include education, practice, licensure, and discipline. The regulation of nursing practice assures each state has clearly defined standards of how nurses perform care, manage delegation to team members, and overall scope of nursing practice. Each state has clearly written standards of nursing practice that support the Nursing Practice Act. Now, to elaborate on that, each jurisdiction has a law called the Nurse Practice Act, which is enforced by each NRB. All states and territories legislated a Nurse Practice Act, which establishes a Board of Nursing, BON, with the authority to develop administrative rules or regulations to clarify or make the law more specific. Rules and regulations must be consistent with the NPA, the Nurse Practice Act, and cannot go beyond it. These rules and regulations undergo a process of public review before enactment. Once enacted, rules and regulations have the full force and effect of law, and nurses must comply with the law and related rules in order to maintain their licenses. What is the NCSBN? The NCSBN, or the National Council of State Boards of Nursing, is an independent, not-for-profit organization through which nursing regulatory bodies act and counsel together on matters of common interest and concern affecting public health, safety, and welfare, including the development of nursing licensure examinations. Now, the NCSBN, whose U.S. members include the nursing regulatory bodies in the 50 states, the District of Columbia, and 4 U.S. territories, have one specific mission, and that is empowering and supporting nursing regulators in their mandate to protect the public. Their vision, leading regulatory excellence worldwide.
The National Council of State Boards of Nursing has member representatives from all states and territories that has adopted guiding principles for nursing regulation. These guiding principles provide the foundation for nursing regulations, which includes protection of the public. Nursing regulation is designed to ensure public safety and prevent from harm. In addition to protecting the public from harm, another important principle that nursing regulation holds is the issuance of license to practice nursing, an ongoing competency assessment throughout the career of all practice nurse. Ensuring due process rights for practitioner is the responsibility of nursing regulation, and also the Board of Nursing hold practitioners accountable for conduct based on legal, ethical, and professional standards. To enhance the safe patient care, nursing regulation requires shared accountability and collaboration with individuals and agencies in the interest of public protection, patient safety, as well as the nursing education. While the main mission of nursing regulation is to protect the public, it uses the evidence-based standards of practice, advanced technology, and current research. Nursing regulation is also timely responsive to the evolving marketplace. The last principle is globalization of nursing, where it works to standardize regulations and access to licensure. In order to address the social political challenges of globalization, nursing regulation requires fair and ethical practice.
In an increasingly connected world, nursing care more and more often transcends the boundaries of countries and continents. NCSBN's Global Regulatory Atlas is the first comprehensive resource tool available on the regulation of nurses in countries around the world. The Global Regulatory Atlas is a free resource tool available on the NCSBN's website that allows regulators and educators to easily compare regulations in their own jurisdictions with those of their neighbors. Researchers can access data from around the world, and nurses considering immigration can view the policies of the countries to which they might migrate. It provides regulatory information, including licensure requirements, levels of nursing, and mandatory education.
Governance powers of the nursing regulatory body as included within the Global Regulatory Atlas. Universal jurisdiction. Governance powers applicable to all universal jurisdictions include licensing and registering nurses, administrating nursing laws and regulations, making decisions about scope of practice, creating legislations, and disciplining nurses. However, peculiar to the Texas jurisdiction, in addition to the above, is regulating entry-level schools of nursing in Texas.
The NURS Compact Licensure Agreement. A NURS Compact Licensure Agreement is a consensus law put in place between states that enable a nurse to work in his or her primary state, as well as in any other states under the Compact Licensure Agreement. In other words, if a nurse wants to practice in any state under the Compact Licensure Agreement, there is no need for them to take an exam or go through a taxing and costly application process again. In order to be eligible to be a compact state, each state must join the NURS Licensure Compact, which binds them into a legal contract with other states and permits the practice of nursing easily among them. There are currently 38 states under the Compact Licensure Agreement. The NURS Compact Licensure Agreement only applies to licensed vocational nurses and registered nurses. It is important to note that the Compact Licensure Agreement does not include advanced practice registered nurses. Therefore, they are required to obtain a license in any state that they wish and want to practice. Rules and regulations differ from state to state. All states and territories legislated a Nurse Practice Act, which establishes a Board of Nursing with the authority to develop administrative rules or regulations to clarify or make the law more specific. Rules and regulations must be consistent with the NPA and cannot go beyond it. These rules and regulations undergo a process of public review before enactment, and once enacted, rules and regulations have the full force and effect of law. One such law is an agreement, the Nursing Licensure Compact Agreement, between states that allow nurses to have one license but the ability to practice in other states that are part of the agreement. Such an example is having a Texas nursing license with the ability to practice in Mississippi, which is part of the Nursing Licensure Compact Agreement. Now, two different viewpoints for nursing regulatory bodies emerge. One such example is Texas, which is part of the Nursing Licensure Compact Agreement, compared to California, which is currently not part of this compact agreement. This is an example where two different viewpoints of nursing regulatory bodies affects the patients and where nurses may practice. The NLC, the Nursing Licensure Compact Agreement, increases access to care while maintaining public protection at the state level. Under the NLC, nurses can practice in other NLC states without having to obtain additional licenses. So what are the legal, ethical, financial, or practice implications? From a legal and financial standpoint, the legal implications of nursing practice are tied to licensure, state and federal laws, scope of practice, and a public expectation that nurses practice at a high professional standard. The nurse's education, license, and nursing standard provide the framework by which nurses are expected to practice. When a nurse's practice falls below acceptable standards of care and competence, this exposes the nurse to litigation and financial costs to the hospital and organization. From an ethical standpoint, ethical decisions occur occasionally, and at times the nurse may face ethical dilemmas on a daily basis. Nurses make ethical decisions about care and delivery, caring and patient advocacy, planning, and providing safe patient care. There are 6 ethical principles that arise frequently for nurses that you may see on a daily basis, and those include respect for persons, respecting the person's and the patient's autonomy and self-determination, number 1. Number 2, beneficence, doing good for the patient. 3, non-maleficence, avoiding harm or doing no harm to the patient. 4, justice, or fairness, equitability, and truthfulness. 5, veracity, telling the truth to the patient. 6, fidelity, remaining faithful to one's commitment. What are the practice implications? Well, based on the information provided, the nurse must determine the type and level of nursing intervention required, and then implement an action. The nurse may determine that the patient's health needs can be managed within his or her scope of practice, or determine that a higher level of care is needed and refer the patient to a mid-level provider or physician, or refer the patient for transfer to a health facility that can provide the care that is needed for the patient. You have to remember, it is always appropriate for the nurse to follow up to evaluate the patient's response to the intervention. From a legal standpoint, to elaborate further, the discipline process for the boards of nursing is intended to be a thorough and formal process. The BONs are responsible to protect the public from the risk of harm from nurses in the form of reasonable laws to regulate nursing. These laws are based on the Nurse Practice Act and allow the BONs to issue appropriate levels of discipline, up to and including termination of a nursing license. When violations occur or a complaint is filed, the BON will review the complaint and investigate the complaint. If there is merit to the complaint or a violation has occurred, the BON will go through a series of algorithms to ensure a consistent and reasonable outcome. The roles of regulatory bodies in regarding the positions of professional organizations can be thought of as a collaborative approach. In the U.S., nurses need to be authorized to practice by a board of nursing, and licensure requirements can vary by state. In concert with its mission, the NCSBN develops cutting-edge resources, initiatives, and programs for nursing regulatory bodies and their roles of regulating nursing education programs. Furthermore, the NCSBN collaborates with nursing education organizations, nurse educators, and other stakeholders and participants in a national nursing education meeting and initiative. The NCSBN produces innovative materials and initiatives to support boards of nursing in their roles of regulating nursing practice and addresses practice topics with the intent to provide evidence-based resources to guide regulatory decision. The NCSBN staff also collaborates with professional nursing organizations and participates in national nursing practice meetings and initiatives. Through collaboration, advancing patient care and producing the best outcome for patients is achieved. Summary and solutions. In summary, the nursing regulatory bodies, the NRBs, that comprise the NCSBN, protect the public's health and welfare by assuring that safe and competent nursing care is provided by licensed nurses. All 59 NRBs in the U.S. are members of the NCSBN. All states and territories legislated a Nurse Practice Act, the NPA, which establishes a board of nursing with the authority to develop administrative rules or regulations to clarify or make the law more specific. Some of the solutions we have established for this project are: 1. To establish one standard of nursing practice acts across all 59 jurisdictions. 2. Continue regulatory bodies' collaborative approach with professional organizations. And 3. Expand NLC's, the Nursing Licensure Compact Agreement, to more states to increase nurses' practice and provide increased options in patient care.
In conclusion, the regulatory bodies established are necessary to protect the public's health and welfare by assuring that safe and competent nursing care is provided by licensed nurses. Regulations provide an adequate system of continuous assessment of health professionals, enforce policies that promote quality and patient safety, encourage education institutions to innovate and change, define scopes of practice, and protect professional integrity. Regulatory priorities encompass the belief that the public should have access to providers who practice safely as defined by education standards and competencies backed by international or national boards and accrediting agencies.